can benefit from it. So do share and do type in your questions. So let's get started with the show, Rohit. So the first question that comes to the mind, I've already given out the statistics, is why is infertility becoming such a commonplace problem these days?
We don't have a simple, clear-cut, one-line answer to this question, Anisha, really. See, there has been a social change. People are marrying late. They're looking for pregnancies much later in the list of priorities. So that's one big area where pregnancies have somehow been deferred these days. So that's one area. Then, of course, there's things like lifestyle issues like obesity, more of thyroid and other diseases. So all put together, I would say it's not one factor. A lot of factors have come in, and which is why possibly more and more couples are seeking help as far as fertility care is concerned.
Okay, but is there any lifestyle issue involved here? I mean, is it because our lives are more stressful? Is it because we take more packaged foods? You know, the times during our grandparents' times were so different. You know, at that point of time, our dadi having three, four kids was routine. It was, you know, fertility was high. Why are there any lifestyle issues that lead to this problem?
Yeah, see, basically, we've been not very clear about the slotting of fertility diseases as to what category they belong to. Is it a lifestyle disease or it's like an organic disease like say tuberculosis or anything else? It's a mix of two. So you do have conditions where fertility is a consequence of some disease, but that's rare. Most of the cases, fertility is a problem because of late marriages, the female partner being getting older as they keep trying for a child and delaying childbirth. So that's the commonest cause. And then, as you mentioned, anecdotally, we are all used to large families, cousins in the families, and all that. And now, nuclear families staying together only in extreme situations, maybe only in the villages now. In cities, you have nuclear families, so you have to do everything, stressful lives, double income. So, all put together, yes, you would say that maybe they're not staying together that often. Maybe they are getting married later. Maybe they are taking too much of junk food and more smoking, more alcohol in the society these days. So all put together, yes, some of it or maybe most of it is due to lifestyle problems and some of it is because of organic diseases. But it's not so easy to slot fertility as a particularly lifestyle problem or a particularly organic disease.
Right, Rohit, but then should I ask you a question which is perhaps politically incorrect in this day and age when you talk of women empowerment? What's the right age to get married? And what's the right age to bear children?
So that's the $1 million question. So many people ask this question all the time. So like getting married and having a child is there's no perfect time or a perfect age. So many people asked us about the COVID. Should we get pregnant during these days or not? So there's no perfect time as yet. If you feel it's right, that's the right age for you. And if you feel you're ready for a childbearing, that's the right age for you to become parents. It's all about the slotting and the prioritizing that's happened in the last 20 years in the society per se. As we have grown economically more stronger, maybe the urge to have children and a child-free living that sense has come down, and more people are more focused on the material things in life. So that's how it's happened.
Okay, put it, then maybe I should put it other ways. When is it too late to get pregnant or to have a child? Is there a cutoff after which you fall off a cliff? Is there something like that?
Yeah, so that's also a very good question that keeps popping up all the time when we converse with people. See, again, we feel that the biggest stumbling block today is the female age because as they grow older, the egg quantity that they carry in their ovaries that diminishes, and the quality of the egg also suffers as one grows older. So there are many people who take the age of 35 as the cutoff age. Some talk of 37. You can't have a calendar date as to this is the time that you have to get pregnant. It makes more sense to tell people that as you grow older, it is that much more difficult to have a child. So in case you do have having a child as part of your priority or in the horizon, then you better do it as early as you can so that the childbearing and the getting pregnant part is smooth as possible. So I would put it that way, not really look at an age of 35, 37.
Okay.
Theoretically speaking, at the age of 30, you've already exhausted almost, age of 37, you've already exhausted 80% of your eggs.
Hmm.
So that's one figure that you have to remember in your mind. that most of the eggs are finished by the time that the lady is touching 37.
Okay, let's just try hypothetical situations. Usually, you go to college, you will do a post graduation, and if it is a 4-year post graduation course, 4-year graduation plus postgraduate course, very likely that you can get married between 24, 25, maximum 27. And some people may start, planning their families 28, 29. And they then, get concerned that they're not conceiving, and they also feel that the time is ticking. When is the right time to consult a doctor if you feel that you're not making progress and perhaps the time is running out?
So that's again a wonderful question. So basically, as you've put it out very nicely, the structure these days is such that you don't really look at a marriage before 26, 27. And then you want to give yourself some time for the compatibility to get in. So maybe 28, 29 is when you actually start looking at a pregnancy or a family life. And then you give yourself a year's time. So again, basically what we are saying is a healthy young couple in their mid 20s or even in their late 20s, they have a 1 in 5 chance of getting a pregnancy per month. So if they've tried for 6 months and they haven't had a pregnancy, so they should now be conscious. Looking at specialist advice, I think they should definitely try for 1 year. If that hasn't worked for them, then that's when they should look at a specialist opinion. Before that, you have to remember that pregnancies do not happen every cycle. So you have to give yourself a solid 5, 6 months of trying time within which most couples would conceive. So once that's done, and then you're not getting pregnant, then there's no point in delaying further because the window of fertility is then shrinking every day. So then that's the time that you should look at a specialist opinion.
Okay, so these days, if you have to buy a phone, we do proper research. We will compare our
Absolutely.
models, pricing range, features, everything. So if you are saying that take that 6 months out to plan for your pregnancy and try, what is it? One, two, three that you should do? Should you be counting your ovulation days, your timing your cycles? How often do you need to have intercourse during your fertile period? One, two, three. What are the things to do? Are there diet restrictions or suggestions? If you can give us 3 top things to do when you're trying to improve your chances.
See, inherently, intrinsically, you know you're healthy. So if you are a healthy person, you have regular cycles, you've never been operated upon, you don't take regular medication for anything, you stay away from alcohol, smoking, and other vices. So that's a ideal couple for us. If that's an ideal couple, all that they need to do is to be together maybe twice a week without counting the dates and looking at the watch when they are together. That's good enough for them. And 89, 90% will conceive within 6 months. Yes, if you've had pelvic surgeries, if you have regular cycles because of some reason, painful cycles, if you have some menstrual cycle related issues, then you're conscious that something may be wrong with you. Such couples, after 2, 3 months of trying, they can take an opinion in sense they can consult their GP or a gynec to understand if they're physically all right. In sense that they're trying naturally at home, what they need to remember is that the female, she produces eggs by dozens every month, but only one egg out of these dozen eggs actually mature. And in most cases, the egg is ready for ovulation, that is popping out of the ovary around the 14th day of the cycle. So the best time to be together is from the 10th day of the cycle to the 17th or the 18th day of the cycle. But please remember, marking it on the calendar, trying to be together only during those 2 days or 3 days makes it very stressful. So
Okay.
the best thing to do is to be together on a non-watchful way. Just be together twice a week, and that's the best for you.
Okay.
And this is something that is a good steady advice for most couples for the first 5, 6 months of trying.
All right.
For the man as well, he should be conscious that he's not obese, non-diabetic, and he is also not smoking. So these are things that should make you alert that if I am doing any of these, or maybe something's wrong with me, then I consciously take an attempt to see somebody before it's too late.
All right. We've already started getting some questions, Rohit, and You said that if you don't have lifestyle problems, you haven't had surgeries, you're good to go. These days, that's quite a miracle to find, the people with great health who exercise regularly. And, so now we are getting a few questions, and we've got a question asking, does diabetes affect fertility in females?
See, diabetes affects both men and women. In men, it works in a different way. In women, it does affect them. See, most people, which we call polycystic ovarian syndrome, we put them as pre-diabetes. So what diabetes does is worsens the egg quality. It causes other metabolic diseases which have an indirect effect on the oocyte quality, on the egg quality. And they also are mostly associated with obesity. And obesity has its own set of problems during pregnancy as well. So diabetes is on the rise, and if you are diabetic or you're borderline diabetic, then the best thing to do would be to go for diet and exercise before you actually contemplate getting pregnant. And once that's settled, and in case diabetes is still there, you should look at an opinion with an endocrinologist, treat that or cure that, and then move into fertility treatment.
So for women, is PCOD the only way you're impacted if you have diabetes? Is that the only connection with diabetes? What if I don't have diabetes? What if I am pre-diabetic and it is not diagnosed? Will that also lead to PCOD and hence affect my fertility as a woman?
No, we are not saying that PCOD and diabetes are cause and effect. There is an association of PCOS with diabetes. That's more the way to look at it.
Okay.
In diabetes, there is a worsening of the air quality, and that's something which is not measurable. So that's the problem. And then there are other coexisting morbidities. So there's obesity. There could be a heart condition also. The liver might be inflamed or might have fatty liver condition. So all these kind of coexist in the same person. We call this the metabolic disease. So if you are diabetic and you are also obese, it makes sense to correct all these or maybe control that and then plan a pregnancy. We also have to be alert to the fact that diabetic people, in case they're not properly controlled, there are higher incidence of babies with heart defects and spinal defects and so on and so forth. So to have a healthy child, it's very important that the sugar levels be controlled.
Okay, so then my question goes to another question that we have received from a viewer who's saying, does type diabetes affect fertility in women? Now, if you have type 2 or you have high sugar, there are lifestyle changes. You can cut down your sugar, take regular exercise, at least 45 minutes of walk or jog every day. Try to control your type 2 diabetes. Now, type 1 diabetes is different. You have to take your shot. So, does it mean that you can still conceive even if you're taking insulin shots? Can somebody with type 1 diabetes also conceive naturally?
No, absolutely. Most people with diabetes would eventually get on and go and get pregnant naturally. This is one thing we have to understand. Just because you have a lifestyle condition, just because you have PCOS or endometriosis, it doesn't mean that you cannot conceive naturally. We have to be conscious of the fact that we have a disease, and therefore we should seek help earlier than usual. But most people, thankfully, even now, with diabetes would get pregnant on their own and they would have healthy children. It's just that if you are diabetic, type 2, then there's a possibility that you can yourself go and correct yourself to a large extent with diet exercise. So that's something that should not be missed out. You should not really jump into a pregnancy with adequate preparation. That's what you're trying to say. But if you are diabetic and you've corrected yourself, and you can definitely get pregnant on your own, and if you get pregnant, chances are you'll have a healthy child as well. So there's no need that you need to consult a doctor, emergency or on a priority basis. It's only that if you tried enough not getting pregnant, then don't delay. That's when you see a doctor.
Okay. Another question that we have is, does fibrosis affect pregnancy? Now, this isn't, the chance to get pregnant, but you're already pregnant. Will fibrosis affect your pregnancy?
I couldn't get this. The process meaning?
The question is, how does fibrosis affect pregnancy?
Okay, fibroids. Fibroids. See, they are non-cancerous tumors in the uterus, in the womb. They could be of any size, any number, and any location. 30% women carry fibroids asymptomatically. So you don't even get to know that they're carrying fibroids, and you only detect when they undergo a C-section or when an ultrasound is carried out. So as I said, even in fibroids, most women with fibroids will have no problem having a pregnancy or delivering a child easily and safely. But if there is a fibroid right in the womb where the baby settles down, then there is a higher incidence of miscarriage. If there's a large fibroid which is making the uterus angle difficult, then maybe the pregnancies are difficult to achieve. By and large, a single small fibroid in the uterus, not affecting the endometrium, not affecting the angle of the uterus, is not causing problems to most women.
All right. So another question that we are getting is, if women want to get pregnant naturally after the age of 40, what would you suggest? I mean,
All women can get pregnant at whatever age they want to. It's just that what we are trying to say is at the age of 40, most of your healthy eggs have been exhausted.
so you have
So,
risked pregnancies.
yes. So, in case that you're looking for a pregnancy, you should give yourself number of attempts. During those attempts, you should be conscious of the fact that maybe you did not get pregnant this particular cycle because the egg quality was not good, and there's no problem trying the next cycle. There's so many people out there who've gotten pregnant in their 40s and they're healthy children. The proportionate of children who are born in women who are in their 40s, who are not healthy, is also on the higher side. So once you do get pregnant, ensure that you see a good fetal medicine guy so that in case the baby is not healthy, that's diagnosed early and you're not saddled with an unhealthy child all your life. So that's the touch point that we want to establish here, that you have to be conscious of the fact that the chances of pregnancy are lower and the chance of a miscarriage or a child defect is higher. So you have to make sure that you are properly screened and guided during your pregnancy.
All right. So another question which is coming is zinc helpful in fertility? In infertility? And I also want to add something from my side. There is a lot of talk about better lifestyle, uh, nutrient deficiencies, and how they impact, your chances to have a child, your fertility rate. Some people say, you're deficient in the vitamin D. Indians don't realize, but they're severely deficient in vitamin D, and that also affects your immunity. Somebody says zinc affects your immunity, the lack of it. It's this or that, and by the end of it, you're popping 100 pills. I want to be safe. I want to have a child. I don't want to have not done enough on my own. What would you suggest to these people? Is zinc going to help? Is vitamin D going to help? What should one do?
So, of course, in life, you come across all kinds of people, extremes of opinions. I have a very simple take on this. In case you're on a healthy lifestyle and your diet is balanced, you don't need supplements. Most of the supplements that you take are not even digested or taken up by the body. Having said that, yes, zinc does have a role, especially in men, because it improves the sperm parameters. In most people, it is a micronutrient, meaning that you require very little amounts of either zinc or other metals that are needed in the diet. And there's no need per se to go out and actively take that through supplements. If your diet is balanced, that's good enough. So that's what you have to take as the central message.
All right. Another question that we've got is, what is the role of AMH in pregnancy? Does high AMH cause infertility? Now, AMH is the anti-mullerian hormone. So can you please elaborate a little more on this? Because we are hearing about this hormone and its impact on chances to conceive.
All that you need to get pregnant is a healthy egg and a healthy sperm and being together often enough. You don't need an AMH to get pregnant. We who practice fertility, we need tools to be able to converse with our patients, and it's a private conversation mostly. So AMH is a wonderful tool that we use for counseling of our patients. AMH basically, as you said, Anisha, stands for anti-Mullerian hormone that indicates to us the ovarian reserve as to how many eggs are there in the ovary. For us, a simple calculator is the higher the number of eggs that are available, more is her chance of having a child. And lesser are the number of eggs available, lesser is a chance of having a child. It's that simple as that. There is no AMH below which nobody can get pregnant, or no AMH above which nobody can get pregnant. So AMH is not to be taken as an indicator of not being able to get pregnant. It is just a counseling tool that we use to be able to give you facts and figures for you to be able to decide what kind of therapy you want.
So does it matter or not? Because we are doing increased testing of all kind of hormones. Is it really a true indicator of how many eggs do you have, or should one get go through regular sonographies to get a better idea of how many eggs one has?
Wonderful question again. So AMH has had a peculiar history. The kits that we use to check AMH has changed very often, and there is a reliability issue as far as the AMH quality, the testing itself is concerned. And now, as you said, we do all kinds of tests to kind of confuse the patient. So my first point here is AMH is a good tool for counseling and not necessarily for you to interpret. The second point that I'd like to mention here is if you have regular cycles and if you are in the early 30s or late 20s, you need not bother with your AMH. However, in case you are planning a therapy, whether it's an IVF or some other treatment, then to know your chances of pregnancy, to know how soon you need to take an IVF, AMH does help. Because lower is the AMH, faster you need to think in terms of getting a therapy done or a treatment cycle done. So that's how I use AMH in my practice.
All right. So let's say I am less than 30. Say I'm 28, 29, and my AMH is low. It shows that my eggs are not too many. Is there any way by which I can make my body make more eggs? Can I have better diet or medicines that help me produce more eggs?
Okay, well, beautiful question, and this gets us so very often. So again, we have to understand that purely an AMH is a mathematical number, and we would not trust us unless we do an ultrasound ourselves to correlate the AMH value with the ultrasound image. Usually, the ultrasound is a better tool to assess the ovaries, gives us a better indication of the number of eggs that are available. Having said that, if the AMH and the antral follicle count, that is the number of eggs that we can see with our eyes in the ultrasound, they are matching, then we have to accept that not all women are the same. Maybe this person was born with less number of eggs. That doesn't make her less fertile. That just tells us that she needs to speed in her approach to getting a child. She needs to move for a faster method to get a pregnancy happen to her. That's all that needs to be told to you. Yes, are there medications by which we can go in and improve the egg reserve? Unfortunately, no. Egg reserve is a finite thing. It is depleting on a daily basis. So there's no medication by which I can improve the egg reserve. If the person is nutritionally deficient, she is obese or very thin, then correction of those things may help. But essentially, egg reserve is an inherent thing. It's a genetic thing. It's an inherited thing that doesn't change with medication. And that's the sad part as of now.
But I'm sure there are very, very small percentage of women who do not have sufficient eggs. I mean,
unfortunately, I would not say it's a small percentage. More and more people are coming to the clinics and they're showing up as unsuspecting people, young women showing up with low ovarian reserve. So that's something that we have to always, as practitioners, guard against. We have to look at an AMH test and an antral follicle count interaction with the patient just to be sure that we are treating the patient right and we are not guiding her into a ultra therapy unnecessarily.
All right, so the not something easily to digest that you do not have a good reserve, but sometimes things are different. Now, this entire journey of infertility is a very hard one because one, it is not seen as a disease, it is hushed up, it is seen as a stigma. So a lot of couples struggle with it psychologically, and what impact have you seen of infertility? Because this is the question we're getting. What impact does infertility have on psychological well-being? And then does this become a catch-22 situation? You're stressed and then you can't conceive, and because you can't conceive, you're stressed. So it becomes an unending circle, and you don't get the results you want.
So it's a sad thing, but it's unfortunately a true thing. See, I try and keep bias out of my conversations, but there's no doubt that most women who approach us for help, they are the achievers in their lives. They have done something with their lives. They're professionally qualified and they're successful in whatever they've done. So when they come across this, let's say, a failure or inability to get a pregnancy on their own, they take it among themselves as kind of a failure, as a blot in their lives. So they have been conditioned to believe that having a child or bearing a child is their responsibility. And if they fail, that plays on their minds. So there is a denial, and then there is a very difficult acceptance of the situation, and that's how it happens. So that's something that we need to educate ourselves first, and then therefore the society, that this is something that we need to get out. In most cases, it is correctable if it's a lifestyle disease. And in some cases, it is not correctable, it is beyond you, but it is treatable. So just as because you have a eye power issue and you go for a specs and you don't really think about it, I think time has come that we should look at fertility as one of those things which can largely be corrected today and can be treated. Yes, the stigma is there, but it's much better than what it was before when I started practice 15 years back. And I'm sure that with the younger people coming up, it's going to improve even further. So that's something that we have to watch out for. There's a lot of motivating, talking to, counseling that needs to be done on a daily basis, on a regular basis. Most of these women are very sensitive and they need to be told that it's not their fault in any way. But then it kind of builds up. It kind of builds up. When they succeed, they're so much more positive and they kind of act as our counselors and talk to our patients in a much better way. And that's how the story builds up. So word of mouth has a big effect. And that's how you can see that more and more people are accepting this therapy and coming out in the open.
Right. Another question that we have got is, what are the early signs of infertility? How can you tell that you're going to have a problem in conceiving? Any signs?
So we've kind of done this. See, in men, there's a very fair chance that you may be infertile if you've had a pelvic surgery or a surgery to your testes very early on in your life. That's one area that you have to be careful about. If you're diabetic, if you're morbidly obese, so then that's another concern. For women, again, if the cycles are not regular, if they're painful, if there's a pelvic surgery done to her, she had an infection, then those are signs and symptoms where you can kind of sense that something may not be right with you. If there is a family history of miscarriages or maybe early menopause, so that's something also that people need to watch out for and be aware of in their family tree so that they can also seek help earlier than usual.
Right. Another question that we have got is that does just see the question that that we have is that does weight or BMI affect the fertility?
Yeah, of course, it affects a lot of other things other than fertility as well. See, ovulation, that is the ability to produce an egg and grow it to maturity and release it, is a very sensitive thing. It depends on a lot of factors. And the body weight being all right is a broad indicator that things are all right. If you're too thin or too obese, then something is not right with you. Metabolics is not working right in your body. So there's a high chance that body kind of shuts off their reproductive activities so as to concentrate on other aspects. So the reproductive function is compromised in somebody who does not have the right BMI. When we say BMI, we talk about BMI of 23, 24, 25. That's the ideal. But again, nature is very forgiving. So it's not that you have a BMI problem when you are 26 BMI. It's only the extremes of BMI, maybe 35 and above, and maybe 15 and 16 kinds. Those have BMI related problems. So if you are 34 BMI and you want to bring it down to 30, all for it. But don't start fretting that just because I have a BMI of 29, I'm going to have fertility issues.
But it's always a good idea to be healthy, right?
It's always a good idea, not only from fertility point of view, from all other aspects, your cardiac health and your any all the other health, endocrine health, all is dependent on the BMI.
What you say,
it's a coexisting thing.
If somebody has high BMI and they have thought that they will start planning, they shouldn't say, oh, my BMI is high, so I'm going to have a problem. What they should do first is to fix that weight problem, adopt a good lifestyle, and then go with a positive attitude to try, right?
Very important, very important. So if you have a high BMI, you need to correct it. But when I say you need to correct it, I kind of make it sound as if it's easily correctable. The attitude should be, we should look at doing things which can be done in our capacity to improve it. And that's good enough. That works for most people.
All right. So now we have another question which is coming. What is the right age for IVF IUI treatment? Is there a right age?
No, unfortunately or fortunately, there's no right age for these things. I would say there's a right time, and that's when you've tried for 2 years and still haven't had a pregnancy, and you've been to a doctor and he says that things are all right and I don't know why it's not working. So that's one time that you can look at an IUI and IVF to kind of proceed further. The other time is when the doctor has actually checked you thoroughly and has actually found a problem, like the eggs are depleted, the sperm quality is pretty bad, or maybe the tubes are blocked. So these are conditions which are not correctable by medication, and that's when IVF comes in to help you. But in most cases, you should give yourself a fair trial of 2 years if things are all right to get a pregnancy naturally. Remember, natural conceptions are considered the best because A, that's more acceptable to the client, and B, there are lesser miscarriages also associated with this. So natural is the best. If that doesn't work, then after 2 years, you could look at an ART.
Okay. So keep trying naturally for 2 years, and only if you fail, then should you think of IUI, IUF, and there's no right age for it. It is where you are on your journey that should actually decide. But is
Absolutely.
there a cutoff for IVF and IUI also, that you should, after a point of time, not do it?
That's the unfortunate part. So we have to understand that pregnancy is a function of the reproductive age of the female, and if the female has crossed 50, she would be in other conditions be menopausal, and that's when nature tells her not to think of a pregnancy. But in today's scenario, we could hire eggs from somebody and get her still pregnant when she's 55 or 60 or 65, and be very happy about the fact that we've gotten her pregnant. That's not the right approach from the medical point of view, because getting her pregnant is not the only thing. You have to stay pregnant, you have to deliver a healthy child, and you have to grow the child into a meaningful life.
Yes.
So all that is dependent on the activity and the happiness and the all that is also factored in. So I would say that beyond 50 is what we should call it a full stop. As far as the younger side, of course, you could theoretically get pregnant at 21 and look at a pregnancy at 21. But before 23, 24, it doesn't make sense to look at ART for your pregnancies. You should try naturally. If that doesn't work, then you should look at an ART.
All right. So, Rohit, we have discussed diabetes and the impact on fertility, but there is a question coming in. Does severe PCOS condition lead to infertility? Now, this question is very interesting because, PCOS is becoming very prevalent, but you have very non-stereotypical women, say Victoria Beckham. She's thick thin, she has 4 kids, and she has PCOD. So does PCOD, a severe PCOD, lead to infertility?
So again, I'm so happy you've asked this question. In today's scenario, we kind of put people in baskets so that it's easier for us to kind of relate to them. So PCO is one big basket, endometriosis is another basket, and poor ovarian is also the third basket, I would say. PCO for long has been associated with obesity, and I would say unfairly so. We should not look at body shaming and talk about people being only obese and therefore PCO. PCO, we have to remember, is again a genetic condition. And there could be all kinds of PCO. There could be thin PCO, there could be a normal body type PCO, and there's, of course, the obese PCOS. Everyone is different. What happens essentially in PCO is there's an oversupply of eggs for whatever reason. And this oversupply of eggs confuses the body. The body is not able to select the right egg every month. So there are less menses, less ovulation, and therefore less pregnancies. And very often the pregnancies happen with bad eggs. So there's a higher incidence of miscarriage. So that's the issue. That's the conundrum that happens here. In most of the cases of PCOS, because there is a supply of eggs that's good enough, they can eventually have a healthy pregnancy. So we are happy that PCO outcomes are very good, in the sense that most women with PCO will end up happily pregnant, either naturally or through some therapy.
Okay.
Cannot say the same thing about poor ovarian reserve.
Okay, but for PCOS, it is not a death knell. There
Absolutely.
are you can find true meaning in your fertility journey, and there will be fruition. It is not the end of the road if you have PCOD. Okay, now I have another question, and perhaps I think this is the last question. What is the reason for early menopause? Can one get pregnant during perimenopause? I don't know what is perimenopause. Is this premenopause? Can one get pregnant in this time?
So as we've discussed throughout the day today, a female is born with fixed number of eggs and she uses of her eggs. So towards the start of her reproductive life and towards the end of her reproductive life, she is not so smart at selecting the right egg. So early in her early 10s and 15s, in the teenage age, she has a lesser chance of a pregnancy. Not that she's looking for a pregnancy, because the selection of eggs is not good. And so also towards the end of the reproductive life also, she doesn't select good eggs. So that's the perimenopausal part, where the cycles are happening haphazardly because of bad eggs mostly, and therefore the chances of pregnancy per se are low. See, early menopause happens because your eggs have exhausted. Either surgically they have been removed, or because of some disease like endometriosis, or because you were genetically so designed that you had less eggs. And if you've moved into menopause, natural conception is no longer possible. The only way we can get your pregnancy is through donor gametes, if you take eggs or higher eggs from somebody else. So that's the only way we can get you pregnant. Perimenopausal, yes, because of our practice sense, we have incidental pregnancies happening all the time. But in most cases, remember, perimenopause is also associated with poor quality eggs. So there are hardly ever pregnancies that happen which are healthy and which give to a healthy offspring. But it may happen.
All right. Thank you so much, Dr. Gutgutia, for taking us through this session and answering so many questions that have come in on infertility. Thank you so much for sparing the time, and thank you for clearing the air, at least on some of the misconceptions that exist. What Rohit has said is you need to have a healthy lifestyle. You should be stress-free and just concentrate on being with your partner at least twice a week, so that you are successful in your conception journey. Thank you so much, Rohit, for speaking with us and answering all the questions that came in. Now, on this infertility month, let us all assure couples who are having difficulty in attaining parenthood that they needn't be disappointed. As Dr. Rohit just said, you can always keep trying with a positive mindset, and there are doctors that are there to assist them with advanced and proven medical technologies and compassionate care, so that they reach the destination of their journey that they have set on. If you have more questions, you can send them to us through WhatsApp, or you can put the WhatsApp button on this page. And don't forget to follow us and stay updated on all the concerns about your health and well-being. We will always keep trying to get them clarified, get the best doctors to help you with all your queries. You can also get quick response to many of your questions related to contraceptive care at Ask Tanu FB page through an instant chat. So do check out that page, and if you need those questions, do type in the question on the instant chat. This show was supported by Biocytus Pharma under its public awareness initiative, Bio for Women. We will be back with another special show on women's health again very soon. So keep sending us all your questions, and we will certainly include them in our next show. Till then, stay at home, eat healthy, sleep well, and keep giving your mind and soul a daily dose of positive thinking. And don't forget to maintain personal hygiene and social distancing for yourself during the COVID time to keep yourself protected from the coronavirus as well. Goodbye and see you soon.